Well, that's great information, but sometimes we don't always pay attention. We do things wrong, we don't take care of our food right, and we end up with food poisoning. What are some of the symptoms of that?
Well, the most common symptoms are nausea, vomiting, and diarrhea.
Do you have a fever? Is there a certain time frame that occurs in?
It depends on the type of food poisoning. Some food poisoning occurs usually within a couple hours of eating the bad food, but some of them it can be a day or two later.
Now, you can end up, especially this time of year, with nausea, vomiting, and diarrhea, and that it's not all food poisoning.
That's right. A virus that can commonly cause that, as well as sometimes some other bacterial type infections can cause those types of symptoms.
And just like we talked about spreading colds, you can spread gastroenteritis also.
That's right. That's where your hand washing is key.
Okay, now, if you've just got a little virus, you're going to try to treat it at home, what do you do and what do you watch for?
Truly, the most important thing is trying to stay hydrated. So trying to keep those fluids down. If you're really nauseated, just sipping on liquids, not big amounts at a time, is really important. As far as what to watch for at home is if your symptoms are getting worse and not getting better.
Now, what are some symptoms that, this is not right, I need to see the doctor?
Sure. Certainly, if you're vomiting blood or you notice blood in your diarrhea, is it really important that you do see your doctor. Also, if it's lasting more than 3 days, it's a good idea to get in and see the doctor. If you're having severe abdominal pain, that's another good reason to get in to see the doctor. Or if you're showing signs of dehydration.
Now, dehydration, that's what we worry about a lot, especially in children or little kids.
Right.
What are some signs or symptoms of that?
Well, dry mouth is one of the symptoms, feeling dizzy or lightheaded, and then also decreased amounts of urination. And that's a good thing with kids if you notice if they're wearing diapers that they're not wetting their diapers like they should be.
And treating kids' fever that may be associated with it, do you want to use Tylenol, not aspirin?
That's correct. You don't want to use aspirin in children.
Okay. Now, if you have pain, bad pain, localizing pain, might be more than just gastroenteritis?
That's right. Sometimes appendicitis, diverticulitis, which are some really important things to get evaluated quickly.
All right. Well, that's great information. More information can be found at foodsafety.gov.